Okay, welcome back, and we are going to cover chapter 1.2, and this is the 20th century evolution of pharmacy education and practice. So this will be a pretty quick video. Um, let's start with the traditional era, which was back in the early 1900s. And during the first half of the 1900s, more than 80% of all medications were compounded by pharmacy, which basically it means that people would go into a pharmacy or a corner drugstore and they would tell them what they want, and the chemist behind the counter would mix it and put it in a tiny little vial and hand it to them. So completely different than what we see today in a pharmacy. One of the first was Walgreens, started in 1901 by Charles R. Walgreen, and you can see him right here. And he was from the south side of Chicago, and he didn't have any pharmacy education. He was basically trained by a very prominent pharmacist and he learned all the science and the compounding from him. And it wasn't until 1920 when the first pharmacy exam was actually implemented to become like a certified pharmacist. But they didn't really have any pharmacy higher education programs. So they were mainly pharmacy assistants, and pharmacy assistants worked alongside the pharmacist for many years, mainly learning on the job. And it was during World War II and after World War II when the demand increased so much by hospitals and that need of pharmacists and pharmacy technicians, that they started looking at training pharmacy assistants, they called them at the time, instead of technicians, and pharmacists. So that was the traditional era, and it was American Society of Hospital Pharmacists was the first organization developed during World War II to help meet the needs of the standards and the professional support for hospitals and organizing pharmacy training programs. And it was the beginning of the formal training programs for medics and pharmacy technicians by this organization, which you will learn about more later in this course. So it moves us into the scientific era, which I think kind of is interesting because going through the COVID vaccine, this kind of might make a little sense because we've been in the scientific era with vaccines. So the pharmaceutical companies, such as some of these you may have heard of, is Eli Lilly, Merck, Pfizer, Moderna. These are all laboratories that expanded the research and were leading into this new market of drugs. So the scientific area, they started making these medications synthetically, and they were starting to come to the pharmacy all packaged in these pretty little colorful pills. So that was our scientific area of drug development, which kind of led into higher education, which sounds kind of interesting because you think mixing it would be a lot harder. But the first was pharmacology, which is the study of drugs, their use, their side effects, and their interactions, and requires more organized education when they started to learn more about these pharmaceutical drugs. It was in the 60s, 1960s, that the 5-year Bachelor of Science pharmacy degree was required. And then today, it's the 6-year doctorate of pharmacy that's required. Pharmacy technician training in the 60s, there was trained technicians, but they mainly worked in a hospital setting. So if they worked in a retail setting, they just were basically looked at as cashiers, and they really didn't do anything else but just check people out. It was in 1968 that the first pharmacy technician program was ever developed by ASHP, and there is kind of a change that happens right in the early 70s, and that was called the clinical era. Let me move myself over here so you can see this. And this was there was a publication called The Pharmacists of the Future, and basically re-evaluating the role of a pharmacist, because in the 60s they became real retail pharmacy and they just started counting pills, and they were basically, in the 1960s, the pharmacists were basically doing what our pharmacy technicians do today. So they wanted to relook at the role of a pharmacist to share more of their knowledge with patients and providers on drug use. So that's when we started seeing the implementation of counseling of patients and providing appropriateness and effective drug and information to patients and providers. And it also supported the idea of the Health Maintenance Organization, or also known as HMOs, which is now today we would look at it as a type of insurance. And HMOs is like basically giving a lot of ownership to the insurance companies, which became really big in the 1990s. I just put this little image on here to tell the difference between an HMO and a PPO, which are types of insurances. We will learn more about those. You'll probably learn a lot more about those in community pharmacy, but they're different types of insurances that have different requirements and different pay scales. Remember, back in this time when they had medication delivered to them, they usually paid cash. They didn't have insurance companies that covered their medication costs. A lot of times they just came in and paid cash, and that's when we realized it was too expensive and they started looking at options to change it in the 70s, which kind of brings us into this next era, which was the computer and pharmaceutical counseling era. So in the 80s was when the computers were moving into pharmacy practice. Prior to that, every little prescription that you see and it has like the drug name and the patient's name, they used to do that on a typewriter. They'd put a piece of paper in a typewriter. I don't know if you guys have ever seen a typewriter. Some of you guys are probably too young, but research it or YouTube what does a typewriter look like if you've never seen one. And they had to type each one of those individually. So that's where the clerical component of a pharmacy technician was, is they did a lot of that in, typing and supporting the pharmacists in that way. And the computers kind of changed that. We saw a huge expansion of generic drugs. Before that, it was all basically just brand name drugs, but then they changed over to more generic based drugs, which were a little more cheaper, and drug insurance programs because people couldn't afford medications anymore. And then in the 90s was the clinical care pharmacist, where we saw more of the one-on-one counseling, and there is a law that we're going to learn about in chapter 2 called the Omnibus Act, which is where it allows counseling by pharmacists and helping them choose and use the right pharmaceuticals. And because of that, most pharmacy programs moved to the PharmD program, which we know today, which is the 6-year program, and you become a doctorate of pharmacy. And courses became more heavy in pharmacokinetics, like how the drug moves through the body, biochemistry, therapeutics, medicinal chemistry, and learning more about the drug itself and how it works in that body. And finally, the increase in pharmacy technician program started, and that's when we started seeing a transition in pharmacy technicians doing more of what the pharmacists did in the 1960s, where we're filling prescriptions, we're pulling drugs from the shelf, we're filing insurances. One of the main things we cannot do as a pharmacy technician is counsel. So but they did bring in education programs so that they could make sure that the pharmacy technician was aware of all these medications, their names. If there was a generic name that came in, they knew what the brand name is. And you guys are going to spend this whole year learning about all that stuff. So that is all I have for you in chapter 1.2. I encourage you to read the chapter or watch the video that's listed. I hope you have a wonderful day. Thanks.